Hi everybody, welcome back to my channel. I am filming this first clip before tomorrow's appointment. I'm feeling a little choked up, I'm not sure why. So tomorrow I'll be having my appointment with radiation oncology. The reason why I'm filming this now is because unfortunately my appointment is so early in the morning. I have to be at the hospital by 8:15 in the morning. So imagine me getting up and I have to fight, to get access to the bathroom with my son. So I have to be up at least maybe 5:30 to get a head start of my day. And I'm gonna do is like from that appointment, I know I have to meet with the doctor first. The initial appointment starts at 8:30, so I'm gonna meet with her, and she's gonna give me a breakdown of what's, I guess she wants to know how I'm feeling, how was the surgery, all that good stuff, and like an, up to date, how things are going, and I'm sure she's gonna give me the breakdown on what's gonna happen right after our talk, and then around 9 o'clock they're gonna start the procedure, not the radiation itself. They're gonna have me go through a CT simulation. This is like before radiation starts. They have to figure out how they're gonna position me for radiation and build a plan from that initial not treatment. It's more like a plan of how they're gonna proceed, and I know that procedure itself is gonna be about 2 hours. So yeah, it's gonna be a long morning for me. But I am remaining hopeful because I know radiation. I've done my research. It's not gonna be easy, and it's gonna be physically hard for me. But I'm staying optimistic because you know what? I know I could get through this, and I'm not giving up. Anyway, so I will give you guys a brief check-in as I'm heading to the hospital tomorrow, and then I'll give you a breakdown of what happened afterwards. Alrighty, so stay tuned. Good morning. I am doing a little quick check-in. Right now I'm running a little late. So I am heading to the hospital. To the Radiology, Oncology. So I gotta be there by 8:15. It's already 8:10, so yeah, running late. So shouldn't take too long. So I hope that everything goes well today, and let's see what this day brings. So I will give you guys a breakdown in a little while. I'll let you know how everything went for me. Okay, so I'll check in a little while. I literally just finished getting the CT scan done, and they already tattooed my back. So it went quicker than I thought. So I'm not in pain. I'm okay. I'm okay. Anyway, so I'm gonna get changed now, and I'm going to meet with another representative from the hospital, and they're gonna explain to me the next steps. And I also got the schedule for my radiation treatment, so I'll give you guys a breakdown of what is gonna happen next. Alrighty, so just stay tuned. I will give you a check-in when I get home. And I am back. I got back a little, like, quite a few hours ago. It's just I had filmed my thoughts about what happened today, and I put out some wrong information, so here I am refilming everything again. Anyway, so yeah, so I in the clip that I had this morning, I had mentioned I was running late. I did run late. I got to the clinic about 8:30, which it was okay because it's not like they were bombarded with patients, so it was still fine. I went through the process of check-in, like billing and all that stuff. And then right away, the nurse came and got me really quick. And from there, she took me to one of the rooms, and she did vitals, checked my pressure, my weight, asked me questions regarding about medication. I told her everything's in the system, everything's up to date, there's no changes. And then she gave me the hospital gown to change into. And then once I was done with that, then the doctor came in and told me, what they were planning to do. She saw my pathology report of what happened, after the surgery. She says that everything looks good. So she says that it's going to take about 3 weeks of radiation to do for me. So she told me what she was going to do today. And then she says, we're going to have the nurse practitioner come and speak with you. And then after that, we're going to take you to the room. So then after I spoke to the doctor, nurse practitioner came in and spoke to me about, the consent and all that lovely stuff about, the side effects of radiation and what to expect. I signed the consent form. And then a little while afterwards, I was taken to another waiting area. And I was sitting there for maybe a half hour before I got called in to the CT scan room. And well, the lady one of the technicians came and got me and escorted me to that room. And I came in, 2 young ladies, very sweet, asked me to take off my gown. So I took off my gown. She placed a marker showing what the scar of my of where they operated. She had to do that before putting me on that CT scan machine. And she explained what she was gonna do. So she laid me flat face forward on the machine, and they were taking images on the one breast to see how they're gonna position me regarding to when they apply the radiation. And she told me, "Oh, you need to relax." I hate when people say that, because the thing is, like, I'm tense as it is, and you telling me to relax is like I get extra tense. That's not a good move. I'm like, I get worse. So then she had me prop up my legs face down, and then she did like 3 images going into the machine first. Then she pulled me out of the machine. Then for some reason they were trying to position me in a certain way, and then they're like, okay, we're gonna do another scan in. They did it again, brought me out again. And then they decided to do was tattoo the different areas of my back, like 2 on my one side, 2 on the other side, and then I'm not sure if it's 1 or 2 in the middle. And the tattoos didn't hurt. I felt when she put it in, like scraping something in my skin. And I had tattoos in the past, and believe me, this wasn't painful. So they did was they tattooed those areas, and then they scanned me one more time, and then they pulled me out of the machine, and they told me, well, you need to stay still, because we're gonna take pictures. I guess they want to show proof that how they position me and how tattoos are located, so they know what to look for when they start treatment. So they told me, well, that's pretty much it. You go start getting ready to go. She goes, oh, you need to see the patient navigator, because you got to go through some paperwork they got to give you. I was like, okay. The whole process took about half hour. I expected longer. So basically, I was in the hospital for 2 hours. As soon as I was done, as you saw in my last clip, that I was wearing the robe, coming out of the, the CT scan room, I pretty much changed quickly, and then I went to the main waiting area and met with the patient navigator. So she gave me a ton of papers for me to go through. One of the papers is a pass, so I don't have to wait online. Just show the pass. I'm going in for treatment, and that will get me in right away instead of going through a long line and waiting to get screened and whatnot. And then the patient navigator gave me a book to read. Like I got homework material. And also she gave me another paper regarding to, like, if I need to speak to a social worker, if I'm feeling very depressed, they could find somebody that can, I could seek for depression if I need to. And also a nutritionist, like if I need to see a nutritionist for any reason, which I think I will consider at the way I've been, at lately. I'm gaining a little too much weight, and I need to get rid of some of this because I can't go to a gym right now. And also they gave me this lovely little pink pamphlet of information that I have to go through. So part of these things is that it's like care of, the areas where I got tattooed, telling me how to take care of myself on that. Also, after getting the treatments, how to take care of myself. And also she told me that I can't take certain supplements. The supplements I have to eliminate until I'm done with radiation. So I no longer can take vitamin A, which I haven't been taking, but I take it in multivitamins, which I also can't take vitamin C, which I was taking C complex, so I'm no longer am allowed to take that for now. Vitamin E, which I haven't taken in a long time, and Q10, which has been part of my norm of supplements to take, and I can't take it for now because these supplements, they contain antioxidants, so they want me to avoid that, because when you go for radiation, it becomes like a toxin in your body if that stuff remains in your system. So nope, none of this. So I have to find a balanced multivitamin mineral supplements for daily value. Okay, so I gotta reread my bottle of multivitamins to make sure that it's not over too much of anything. And let me see what else. Oh, I'm also not allowed to use regular deodorant, because a lot of the deodorants that are out in the market contains aluminum, so can't do that. So I was able to find deodorants that don't have aluminum in it, so I bought 2 bottles of it. That's gonna be my new best friend for now until radiation is completely done. And also they told me that I have to find certain bras to wear, because like when it comes to radiation treatment, it's gonna be very much like if you're going to the beach and getting sunburn on your body, and it's gonna irritate the skin a lot. And unfortunately, the material of certain bras are not gonna be very good for the skin. Also, anytime that I go for treatments, they're gonna start with having put on Aquaphor on my area. So they have to provide Aquaphor treatments on me every single day that I come in for treatments, and also they're gonna prescribe me so I could be able to do at home when whenever I need to, soothe my body. So I'm gonna be doing a lot of aquaphor. And yeah, that's pretty much it. I will start treatment on October 11th, and it will be 15 minutes a day for 5 days a week for the next 3 weeks. So I already got the list of appointments. They're already set up for me. I will be doing a lot of vlogging. A lot of this. Also, I also got a call from the company, because if some of you follow me regarding to my issues with my insomnia, my doctor who I was doing the sleep study, she had processed for me to get a CPAP machine, and so the insurance accepted the the process, and I wind up speaking to the company this morning. So I have been scheduled to go pick up a machine somewhere in the boondocks of the Bronx. Listen, I lived in the Bronx for, I would say 10 years. So I'm very aware of a lot of the sections of the Bronx. I even worked in the Bronx for years. So I do know. But sometimes, as of lately, the Bronx has become very hot in that area. And please don't, Bronx people, don't get offended. But it's true. So I have to go somewhere in the Bronx. I'm going to see if my sister could, drive me out there, and I could be able to pick up the machine and start using the CPAP. And let's see how that works for me. Hopefully I could be able to improve my sleep, because it has been very difficult for me. It's not been very pleasant not getting a full night's sleep, and a lot of my sleep has not been comfortable. So yeah, that's pretty much it. It's been a busy day today. Anyway, so that's pretty much it for today. Next, at least it's gonna be a calm week. Well, semi-calm, because I still got things to take care of here. Starting next week, I'll have 2 more videos to come out. I have 2 more appointments. I have the vascular appointment on Tuesday, and then my follow-up with my primary. So I hope, well, the vascular, I'm expecting more appointments with him. Anyway, so anyone who sees these videos, please give the videos a like. So anyone who is experiencing journey of cancer, after surgery, they're gonna have to go through radiation. They could see my story and what to expect in their own journeys. So I would greatly appreciate everyone likes. And if you're new to the channel, you're welcome to subscribe. And also, if you've got stories that you would like to share about your own cancer journeys or anything else, you could always leave it in the comment section on YouTube, or you can find me on Facebook. Alrighty, so please, everyone, please stay safe, stay blessed, and I'll see you soon in my next video.